Today, we are breaking down a guide for anyone who's just been diagnosed with age-related macular degeneration, or AMD. We're going to cover everything: the treatments, the costs, and the small, smart changes in your daily life that make a huge difference. Does this sound familiar? You know, that feeling that your life is suddenly run by a clinic schedule? It's a super common feeling. But today, we're going to flip that script. We're moving from that initial fear and confusion to a place of calm and control. And it starts with understanding what this diagnosis really means. So, first things first, let's tackle that big, scary thought that pops into everyone's head. We need to reframe the fear by getting really clear on what part of your vision is affected and, just as importantly, what part is not. Okay, so AMD is all about this one tiny spot called the macula. You can think of it as mission control for all your sharp, detailed vision. It's the reason you can read the fine print, see the expression on a loved one's face, or recognize a friend from across the street. And that's why those are the first things that start to get a little fuzzy or distorted. Now this, right here, is probably the most important thing to understand. AMD is a central vision problem. Look at that right-hand column. You keep your side vision. That means you can still navigate a room, you still have your general sense of space. The goal here isn't to prepare for total darkness. It's to adapt your detail system so you can keep living your life. I love this analogy because it's just so perfect. You can still see the whole picture, the whole room, but that smudge spot right in the middle makes it tough to read the title of a book on the shelf. Your independence isn't gone, not by a long shot. It just means you need a new game plan. Okay, let's talk about the elephant in the room: injections. If your doctor brings this up, it almost always means you have what's called wet AMD. It's the less common type, but it's more urgent because it can change your vision much faster than the dry form. So what actually happens at these appointments? Well, the thought is way, way worse than the reality. The whole appointment might take a little while, but the actual procedure, we're talking seconds. Seriously, after some numbing drops, it's over before you know it. And that anxiety you feel the first time, by visit 2 or 3, it really does just start to feel like a routine. Wow, that really says it all, doesn't it? That shift from fear to function happens fast. Another patient even joked that by their 3rd visit, they weren't scared of the needle anymore, they were just annoyed by the bad parking at the clinic. And that right there is a huge sign of taking back control. Now, you've got to know, this is a long-term thing. It's kind of like managing high blood pressure, not a one-and-done cure. At first, it's pretty intense, often monthly injections to get things stable, but the whole goal is to then treat and extend, spacing those visits out more and more to just maintain that precious vision. All right, let's get into the practical stuff. The money. Nobody loves talking about it, but getting a handle on the costs is a massive part of feeling in control of this whole process. The money math can feel really draining, but a little bit of prep work makes all the difference. I want you to memorize this question, write it down, put it in your phone, whatever you need to do. This single question is your absolute best tool. It's respectful, it's not pushy, and it opens up a conversation with your doctor that could literally save you thousands of dollars a year. So when you ask that question, this is the kind of stuff your doctor is thinking about. You know, one drug might cost more per dose, but let you go longer between visits, which is great if travel is tough. Another might be cheaper, but require more frequent trips. Your job is to help them understand your side of the equation, your budget, your life. Think of this as your homework before you pick up the phone to call your insurance company. Walking into that conversation with this information right in front of you is a total game changer. It turns a confusing, frustrating call into a clear, productive one. Okay, we've talked a lot about the clinic. Now, let's bring it home. Because the right tools and a few simple tweaks to your environment can make a huge, and I mean immediate, difference in how you feel every single day. This is the heart of it, right here. The biggest danger of AMD isn't just what you can't see, it's what you stop doing. You stop trying to read the menu at a restaurant, you stop driving after dusk, you skip a social gathering, not because you physically can't do it, but because the effort just feels too hard or embarrassing. That quiet avoidance, that's where your world starts to shrink. So how do we fight back against that shrinking world? With these. Think of these as your secret weapons. They're not about giving up. They're about fighting smarter. Better lighting, high contrast text on your phone, audiobooks. These things can take a task that feels like a daily defeat and turn it back into a simple, manageable part of your day. I absolutely love this quote. It's a whole philosophy, really. Adapt the task, don't abandon the activity. If reading a physical book is tough, you switch to an audiobook. You haven't quit reading, you're still a reader. Protecting who you are, the things that make you, you, is every bit as important as protecting your eyesight. Okay, we've covered a lot of ground, and it can feel like a lot to take in all at once. So let's pull all these threads together into a simple, step-by-step plan that you can start using, well, today. This is it. This is how you turn that feeling of overwhelming uncertainty into a series of clear, manageable steps. You get clear on the diagnosis, you find your treatment rhythm, you take control of the costs, you upgrade your daily tools, and you know what to look out for. See? It's a plan. And if you remember only one thing from all of this, please let it be this. An AMD diagnosis is not the end of the story. It is not a fixed sentence. Your future is absolutely still negotiable, and the choices you make starting today will shape what comes next. So let's go all the way back to where we started, that calendar packed with appointments. It isn't a life sentence. It's not a punishment. It's a strategy. It's the tool you are using to protect the beautiful, important details of the life you love. The faces, the books, the hobbies, all of it. And if you're feeling ready to take action right now, here's your 15-minute assignment. Grab a notebook, open a file on your computer, and just create a simple one-page note. Put your diagnosis, your doctor's name, your medication, and key contacts on it. This small act does something incredibly powerful. It proves to you right away that you are managing this condition. It is not managing you.